Behavioral and social science research is playing an increasingly larger role in health-related outcomes at the population and individual levels, underscoring the impact of behavioral and social influences on the nation's health. As technological developments fuel new applications, measurements, and data types, health researchers are even more poised to incorporate social and behavioral science research findings into their studies. The Office of Behavioral and Social Sciences Research, OBSSR, developed its Strategic Plan 2017 to 2021 with these opportunities and their inherent challenges in mind. The office will facilitate the integration and continuous communication between basic and applied behavioral and social sciences, encourage adoption of behavioral and social science findings into health research and practice, and enable development of technological resources for behavioral and social science research. Let's go back to the seedling. Once it is planted, the sprout must push through several layers of soil. Resource-intense requirements and poor translation from research to practical settings create layers of resistance to the adoption of behavioral and social interventions. To address this challenge, OBSSR plans to cultivate a body of research to identify key influences that impact adoption and promote effectiveness implementation designs that test BSSR interventions in their practical settings. These steps will enable concentrated knowledge from BSSR interventions to overcome resistance faster, closing the gap between research and the real-world application of interventions. Once the seedling sprouts and pushes through the soil, it must be in the right environment to grow into a tree. In the same way, behavioral and social science interventions must be relevant to population health challenges and easily scalable to be readily adopted. OBSSR can foster stakeholder engagement as interventions are developed and tested to ensure their relevance for population health and facilitate meta-analyses on topics that will enable adoption of evidence-based interventions. To address issues with scalability, OBSSR will encourage the use of technology which has the potential to expand the reach of behavioral and social interventions. Once that the seedling has grown into a tree, its survival depends on its environment remaining ideal. Similarly, interventions must have the appropriate policy landscape to be widely adopted. By fostering collaborations with agencies and entities that implement behavioral and social research findings and evaluate policies, OBSSR can disseminate and facilitate changes in intervention development to improve their adoption. These modifications to behavioral and social interventions in response to the population health policy landscape are akin to a young tree bending in the wind. The Diabetes Prevention Program, DPP, was an intervention that initially consisted of 6 months of weekly group sessions followed by 6 months of maintenance trainings. Before DPP was implemented, it was evaluated with input from stakeholders who recommended that the intervention be simplified and shortened. The simplified version of DPP was successfully implemented without a significant loss in efficacy. OBSSR can leverage this model for other interventions to reduce the time to implementation. A seedling must be planted in the appropriate environment, push through layers of soil, and, as a tree, learn to adapt to daily changes in the weather. A behavioral or social intervention must exhibit similar characteristics, addressing a specific need in population health, moving past initial resistance from research complexities and adapting to changing policies. OBSSR can create optimal conditions for behavioral and social science interventions by disseminating research findings and partnering with key stakeholders to adapt interventions to match policies and needs. These steps will provide more opportunities for behavioral and social science research to improve health outcomes across the nation.